women with stage 4 disease that we can treat, but we can't necessarily cure. And we all know that for most cancers, if we pick them up early, right, that we'll be able to cure them. So early breast cancer, early lung cancer, early colon cancer, these are all things that are curable. But when we pick them up when they've spread to other parts of the body, as I said, we can treat them, but we can't cure them. So I thought what I would do today is really talk to you about a lot of the myths that are out there that are keeping people from coming to get early treatment. And maybe you don't even believe in any of these myths, but I want to tell you what I hear and what I've heard over the past 25 years, so that if you hear people saying these things, you can correct them, okay? So we're going to kind of go through the common myths about cancer and see what the real facts are. So the first one that comes up very often is that if I take a multivitamin or some kind of supplement, I'm not going to end up getting cancer. How many people have heard that? And I think that people spend a lot of money buying vitamins and supplements with this hope that they're going to prevent cancer. But in fact, it's much more complicated than that. And I'm not a dietitian, but I can tell you that there's been lots of studies to look at vitamins in preventing cancers. And in fact, some of these studies have shown the exact opposite. So a very large study that was done at the VA in smokers, hoping that they could use vitamins to prevent lung cancer. And in fact, the group of men who were smokers and got this cocktail of vitamins ended up having a higher risk of lung cancer than the people who did not. Big studies that looked at prostate cancer and could we prevent prostate cancer from vitamins, vitamin D and selenium, lots of effort and money put into that study, and in fact, it didn't really pan out. So I'm not saying that vitamins are bad, but I think, again, to sit back and say, well, I'm taking this vitamin or this nutrient and I'm not at risk for cancer is a very scary thing to do, and a lot of people really do believe this. The second myth, being overweight doesn't really affect my risk of cancer. Does anybody believe that? Do people know about the connection between obesity and cancer? Well, I can tell you that obesity is connected to almost every single type of human cancer. And in fact, not only is it connected to developing that cancer, but we also know that people who get cancer, so women who have breast cancer, if they lose weight and if they exercise, they reduce their risk of having that cancer come back as much as I can do by giving them chemotherapy, okay? So we think a lot about the risk factors for cancer, smoking, and things like that, but we've got an epidemic going on of obesity, and we see that cancer incidence is going up because, as this slide says, 320 cases of U.S. cancer could be prevented every day if people maintained a healthy weight.
Can you define obesity?
What's it, a BMI over 25?
I think so.
Yeah. Okay, and Danielle's going to talk a lot more about this, but I hear very often, well, you know, cancer doesn't run in my family, so I'm not at risk. How many people believe that? Well, that's good. See, I know, you guys don't believe these myths, but again, I want you to talk to the people that do, because there's a lot of people out there, right? So most cancers are not related to genetics. In fact, it's what, about 10% of all cancers actually have some sort of genetic predisposition, run in families. The majority of cancers come really from our lifestyle, from smoking, from being overweight, from toxic exposures. So you don't want to take away anybody's false hope, but just because you don't have cancer in your family doesn't mean that you're not at risk for getting cancer. This kind of goes along with the vitamins, right? That there's really some superfoods out there that if we just ate more of, we wouldn't get cancer. And again, these are huge markets, right? Green tea. How many people, have ascribed to drinking green tea, right? It lowers your cancer risk, lowers your risk for heart disease. B17 extracts, I don't even know what that is, but every time you turn around, there's a new food that's going to help you prevent cancer, okay? What do you think is the real fact here?
They have to be about nutrition. Food, not talking vitamins now. A healthy food.
Absolutely.
Minus sugar.
Absolutely.
Take out sugar and all
Right,
that.
a healthy,
Eating a lot of unnatural foods.
absolutely.
Very few eat organic or very natural food.
Absolutely, that's the answer, right? I mean, we all want just the magic pill, right? We want the magic supplement, the magic food that we can just take and everything will be okay. But it really is a really balanced, healthy diet, plant-based, less meat. Don't eat anything you can't pronounce, right? Seriously, if you go to the store and look at a package and the words on the package are longer than this,
Right.
don't eat that, right? That's all, okay? And don't eat food that's blue, right? Maybe this color blue, I mean, blueberries, but, right?
Don't eat blueberries?
Don't eat fluorescent green food. Don't
Don't eat
eat
blueberries?
food that, no, I'm saying blueberries are
Not
good,
necessary.
right? But they don't look that color,
No.
right? So don't eat things you can't pronounce and don't eat things of colors that you don't recognize. They're not natural, they're not normal, right? Yeah.
Now, salad is very healthy, but the salad dressings that people buy, it's like 15, 20 things of some names.
Again, that's why you're right.
I
You
don't
have
question
to
it.
read the labels and look at what's in that food, okay? So again, I think the point being, there's no one magic superfood. It is all about balance and moderation.
I think B-17 is the name of the airplane.
Yeah, sounds like it, right? There's really a miracle cure for cancer.
There's also B20. No
It's-
pot, huh?
It's out there, and the pharmaceutical companies don't want us to know about it. Anybody ever hear that myth?
Oh, yeah.
Yeah, okay.
There's no pot
And-
smoking.
Again, when you think about the amount of time and effort and money that people spend on these kinds of things, and again, it's really very heartbreaking when somebody comes in with cancer, they didn't come to get treatment because they were doing coffee enemas because they heard on YouTube that that was going to treat their cancer. And it sounds kind of, bizarre, but honestly, we see this, and we see it not infrequently, right? That people don't trust the medical establishment. They think there's something better out there. And again, they spend lots of time and money and precious time, and then ultimately come to traditional medicine when maybe it's a little late for them. You have a comment?
Yes, I'd like to mention, this is in the news occasionally, when it comes to the food coloring, like the reds, the yellows, and the blues,
Right.
most of the countries around, most of the countries that around the world have abandoned it because they cause cancer.
Right. Right.
For some
Everybody,
reason, this is illegal to like use in this country though, it's one of the few countries left where it's, it's still illegal to have these artificial food colorings.
absolutely. I mean, we could talk for a really, we could talk forever, and I don't want to get people all riled up, right? But you're absolutely right that there are so many,
It's all because it looks too, to make the food look,
there are
more
so
rich and
many,
more colorful. and-
right, there's so many additives in our food that are actually banned in other countries. Well, why don't we go through this and then we'll get to that, right? Okay, so again, I just think you gotta be really careful because, again, having a diagnosis of cancer is a really anxiety-provoking, emotional situation, right? We've come to a place where people say, well, I got a little sugar, right? I got some diabetes, I got some heart disease. And we don't think so much of that anymore. But people hear the word cancer and it just, it invokes a lot of fear, I'm gonna die, et cetera, et cetera. And there's a lot of people out there that really prey on that highly emotional, agitated state. Ever hear this one? A needle biopsy can disturb cancer cells and make them travel all over the body. So I'm not gonna go have that lump in my breast biopsy because it's gonna make the cancer spread. Anybody ever hear that rumor? Okay. Again, I've heard this very, very frequently. And the fact of the matter is that this has really been looked at and that there's no data that says that doing a biopsy is going to cause that cancer to spread, okay? There may be one instance where that's true, and that's in testicular cancer. So a man who has a mass in his testes really needs to be very careful. He doesn't want anybody sticking needles in there, because there is some data that that could cause the tumor to spread as the needle's pulled out. But any other biopsy, this has been looked at, and there's no data that shows that doing a biopsy, putting a needle in to finding out if something is cancer, is going to cause that cancer to spread.
But if it's surgery, that could spread the cancer.
Yeah, we're going to get to that. Well, here we are. The next myth, okay? Gentleman in the front row believes this. That if you do cancer surgery, you're going to make that cancer spread all over the place, right? You open the cancer to the air, and all of a sudden it takes off.
No?
But cancer isn't just seed. It's seed and soil. So if you took me to the operating room, cut me open, took a bucket of cancer cells and threw them into my abdomen, they wouldn't just stick all over and start growing and becoming cancer, right? Because cancer isn't just the cancer cells, it's the environment where the cancer cells are growing. It's seed and soil. So this idea that you're going to take someone for cancer surgery, perhaps curative intent surgery, right? You have a mass in your colon, you need to go and get it taken out. And the idea that if you go in there and open it up, it's going to spread all over the place is absolutely not true. And this has been studied. And this is a myth that, again, I hear all too often. I didn't come to surgery because it's going to spread all over the place. So again, I don't want people to believe this. And if you hear people say this, this is in fact not true. Have I convinced you?
Oh, yes.
Okay. Cancer treatment is worse than the disease itself. So, you know, as Dr. DiBiase said in the past, treatments were very difficult. In chemotherapy, we only had 5-FU and a drug called cisplatin, and we didn't have good anti-nausea medications, and so chemotherapy was pretty difficult, right? Now we have good anti-nausea medication, a lot of support. We have immunotherapy, which is completely different than chemotherapy and really has a whole different toxicity profile than chemotherapy, right? And we know how to get people through chemotherapy. But I'll tell you what, here's the fact. Not treating cancer, having cancer spread and grow, will not just kill you, it'll make you suffer, and then you'll die. So I don't know of any chemotherapy or any immunotherapy or any radiation therapy that actually is worse than uncontrolled, untreated cancer itself, right? So I would say that that's truly a myth, and that cancer treatment, almost by definition, can never be worse than the cancer itself. Because unfortunately we know that cancer untreated leads to suffering and death. So again, we have to kind of dispel this out in the community. We have to get rid of this fear. You know, you mentioned Sloan Kettering. Look at their ad, right? Their whole marketing campaign is more science, less fear. That's what we need to spread around the community, right? That has to be the message, not just for Sloan Kettering, but for New York Hospital Queens. People can't be afraid to come and get treatment. They should be more afraid to not have treatment. So we need to start really trying to prevent cancer. And there are ways that we can do that. We can screen for cancer. We can find cancer early when it's treatable and curable. And we really need to up our rates of screening, especially in Queens, because they're not as good as they could be, okay? We need to make sure that people maintain a healthy weight, that they exercise, because we know that it can prevent the most common cancers, and in people who have had cancer can prevent a recurrence of cancer. We need to reduce smoking. You know, the smoking rates in Flushing are some of the highest in the city, okay? And we still have lots of teenagers that are starting to smoke, okay? That's unacceptable. I mean, we know that smoking causes almost every single cancer you can get. So we've got to really work on this. Alcohol, we know that excess of alcohol can also increase your risk of cancer. And Danielle's going to tell you about knowing your risk and genetic counseling. So just very quickly, cancer screening recommendations, mammography. How many women in this room follow the screening recommendations for mammography? Everybody? Okay. How many women in this room take other women to get mammograms? Okay,
Every
not as
cashier
many.
I meet, every woman standing next to me on a checkout line, I tell them to go get a checkup.
Okay. So next year, if I come back and ask that question, how many women in the room are going to take other women for?
It was 5 years
Mammogram.
before I saw a doctor and they found it.
Okay.
It was early,
I think women who do this need to be champions to women that don't.
very.
Okay? Colon cancer screening, starting at, actually, this is an old slide, this has changed, it's now down to 45, right? Okay? Doing a colonoscopy. And you know what? People are like, oh, I don't want to do that, it's disgusting, but you're gonna be asleep, you won't even know what's happening.
That's this new test, where you don't even have to get this thing up your ass, I mean,
The Cologuard?
yeah.
Right, where the DNA test, I mean, that's not quite ready for prime time, okay? And the thing is, so, I don't know if people heard that he asked about another test for colon cancer screening, it's called Cologuard, where you put some stool on a card, you mail it away, and they check your genes, and, you know, that's all well and good, but you need to also understand that when you have a colonoscopy, if there's a polyp at the time of the colonoscopy, and we know that polyps can become colon cancer, you just get that snipped off, right? You get that taken out, that's never going to become a colon cancer. So colonoscopy is not only screening, but it can be therapeutic.
But what if you're like in a low-risk area? What if you're like in the lower risk part, and you still get the colonoscopy, because the other test is okay?
So what if you're in the low risk? We're all at risk.
I said lower.
And by age 45, you're at risk, just by definition of age. So again, don't kid yourself, because again, 10% of cancers run in families. None of us, we all have our unhealthy habits, and we're all at risk, and that's not meant to scare you, but, we can't say, well, I don't need one because I'm not at risk. We're all at risk, right? Otherwise, we wouldn't have these screening guidelines. Cervical cancer screening, I'm not going to go through all this, but guidelines for cervical cancer screening to prevent cervical cancer, and HPV vaccination, okay, can prevent the viruses that we know cause the majority of cervical cancers. That's pretty amazing. That's more than amazing. We have an anti-cancer vaccine. And, I don't want to make a political statement here, but it's very unfortunate that the uptake of that vaccine is incredibly low. Incredibly low. When, in my lifetime, in your lifetime, Dr. Mel, have we had a vaccine that can prevent cancer?
They're talking about giving, we are giving it to young men now.
Yep, yep. But again, I think there's not as much uptake as really should be going on.
The last statement on cervical cancer,
Uh-huh.
why?
Why what?
It says they should not be tested for cervical cancer, women over 65.
Because at that time, again, because we know that the majority of cervical cancers are virally related, and so if you don't have HPV, if you don't have an abnormal pap, if you don't have cervical cancer, your odds of getting it at that age are exceedingly low, okay? And then lung cancer screening, something new in the past 10 years. Again, the most common cancer in this country, causes the most deaths from cancer in this country. We finally have a screening modality that is very effective and can reduce the mortality from lung cancer, and very little uptake of this screening.
But if you don't smoke, you don't take it.
Pardon me?
You've never smoked, you
If
don't.
you're not a smoker, you don't. Here's the guidelines. So 55 to 75 years of age, you're in good health, and you have a 30-pack year smoking history, which means you smoke 1 pack a day for 30 years, 2 packs a day for 15 years, and you've quit you're still smoking, or you've quit within the last 15 years. If you fall into that criteria, once a year you should have a low-dose CAT scan, again, as effective as colonoscopy for preventing mortality from lung cancer.
What causes lung cancer in non-smokers?
Yeah, that's a good
Yeah,
question,
breathing
right?
And why is it so
Probably air
aggressive?
pollution, secondhand smoke, and then there's types of lung cancer that probably are somewhat genetically related, and we just don't know enough about it. You know, there's a certain type of cancer that's very, non-smoking related cancer, that's very common in Asians, something that we treat not even with chemotherapy, but with what we call targeted agents. That's probably a different cancer than a smoking-related cancer, and who knows, maybe in the future we'll find out that's virally related. But I think everybody was shaking their head, I think for non-smokers, it's probably
This also
secondhand smoke, air pollution,
It seems to be also, it seems to be, in people who get it seems to be very, very aggressive.
who get what?
Non-smoking lung cancer.
It can be. I mean, lung cancer in and of itself is a pretty aggressive disease. Okay. So that's really all I have as far as slides, I think. I guess I'll take a couple more.